So let's start with Group 1, and I understand that Susanna Defaya is going to share that position.
Good afternoon, Senator. My name is Susanna Defaya. I'm a resident of the Health Group. Our group advocates that insurance companies must end the practice of rescission, gender bias in cost, and must provide mental health parity.
And if it's okay with you, Senator, what we're going to do is let each of the groups go ahead and share those and then move right into our questions. Okay, great. All right, thank you, Group 1. Group 2, you don't have one, right? All right. And what we want to know about what's interesting about the groups that don't have a point of advocacy, is that really represents great diversity of perspective in that group. And and it's not that you didn't get something important, it's not that you didn't get your work done, it's that you all had really diverse perspectives, and we recognize and appreciate that. So, Group 3, Roxanne Bly, I believe. Oh, did you do a switch? You can have, oh, here we go. You do not look like a rock fan.
We had two of them in our group, and they were much prettier. I'm Angus McPherson, and our group had consensus that there is a real need for a strong, efficient, affordable public option. And I know that it's in your literature, and I think there was consensus that we would really like for you to fight for that in your finance.
Group 4 also had diversity of perspective. Group 5, did you guys have a position of advocacy? Please share your name with us, ma'am.
Sure. I'm Sharon Schaefer, and we have a lot of diversity, but we also eked out a little advocacy statement right at the end here. There should always be multiple options for health care available for everyone, including a private option and a public option.
Group 6, how about you guys?
Hello, I'm Ted Cloak from Albuquerque, representing Group 6. Group 6 strongly comes out with a bold statement that every American should have access to affordable, quality health care.
And I understand Group 7 also had diversity of perspective. Is that the accurate statement there? All right. Group 8, Mark Seaman is going to present his point, right? Or your group's point of recommendation.
Thank you. Good afternoon. My name is Mark Simone. I'm a registered nurse. I've been a public health nurse for 15 years, and so this particularly falls under our group advocacy statement, was that we need to assure an adequate healthcare workforce, including nurses, dentists, and physicians, to care for the Mexicans, especially those in rural communities and from foreign populations.
And Group 9, Kathy Hoover, right?
Hi, I'm Kathy Hoover. We have strong agreement within our group, and our statement is that we believe that a strong public health insurance option is the only way to contain costs and provide equitable access to quality health care.
Last but not least, Group 10.
Good afternoon, Senator. On behalf of group number 10, we would advocate that access to universal health care is a right and the public option is essential.
All right. know that we also have a number of people in the room for whom the position on public option is a point of disagreement, and I think that that's reflected in many cases in the groups that didn't have a position of advocacy or position of agreement at the table, and we want to acknowledge those positions as well. So, having said that, what I'd like to do is now let's go into our questions. We're going to start with Table 1, and I'm going to let the spokesperson for Group 1 introduce yourself and present your first question.
Hello, Senator. I'm Don Mann. Howdy. We actually had some good stuff on it. And one of the things that we agreed about was that one of the reasons that there is so many problems in terms of the discussion is that the American people have so little information. And having said that, what we're asking is that would you request that Medicare for All be scored by the Congressional Budget Office? And the reason that we ask that is that our individual pieces, as they're coming through, no one understands what the actual costs are because we're getting little bits and pieces. If we could actually see what Medicare for All would look like, I think it'd help all Americans improve their life and get a better understanding. Thank you.
Okay, let me address that and say I'm glad to inquire from the Congressional Budget Office if they've done any such analysis, and if so, did they use information and get it back to you and every participant here. I don't know how extensive, if they haven't done the analysis, I don't know how extensive the effort would be, and so I can't assure you that we'll get it done here real quickly. But let me just clarify something that may be obvious to everybody here and may not be. But I find a lot of confusion as I go around to Mexico about what is the public option. Public option that we have proposed in the Health and Education Committee, and the one that's in the House bill too, is not Medicare for all. Of course, Medicare is supported primarily by a dedicated payroll tax. And although people pay something in the way of premiums on Medicare, they don't begin to pay the cost of Medicare with those premiums. The cost of Medicare is covered through the Medicare Trust Fund, which is funded by the payroll tax that is imposed. Now, there's nobody in any of the deliberations I've been involved in Washington who is suggesting that we should have a dedicated tax to provide another program of health insurance for people who aren't eligible for Medicare. Nobody's suggesting that. What we put into the Health and Education Committee bill was a proposal for the Secretary of Health and Human Services to set up a nonprofit entity which would be directed to go from state to state to state and get licensed to sell health care insurance in those states. It would have to operate pretty much on the same basis as health insurance providers today operate, and that is it would have to charge enough in premiums for anyone who wanted to buy one of their policies. Have to charge enough in premiums to offset the cost of any claims that are made and services provided, the cost of administration. The Secretary of Health and Human Services would have funds that could be made available to this nonprofit to allow them to begin operating and doing business, and those would be in the nature of a loan to provide the necessary reserves. It would have to be paid back by the entity with interest, and that's specified in the proposal. So that's both in the House bill and in the Senate bill. So that's the so-called public option. Now that's something which, there are a lot of folks who favor the public option who want something much more like Medicare for everybody. But that's not being discussed in either the House or the Senate. And there are some who oppose the public option who think that it is Medicare for everybody. But again, it's not being discussed. So, anyway, that's a long answer to a short